differentiation from other white matter diseases by MRI? Dr. Mai? Okay.
Thank you all for this opportunity. A rule of artificial intelligence in detection of multiple sclerosis and its differentiation from other white matter diseases by MRI. Probable autoimmune mediated demyelination, which environmental factors act upon genetically susceptible individuals. It occurs about 2.5 million among the world, age 20 to 40 years, and a female predominance. Types: clinically isolated syndrome, relapsing remitting MS, secondary progressive MS, primary progressive MS, tumor-effective MS, and pediatric MS. We have a variable clinical presentation, and tingling, numbness, pain, walking difficulty. This makes the diagnosis of MS is difficult. We have McDonald criteria for diagnosis of MS, dissemination in space and dissemination in time. MRI has become the single most useful test for diagnosis of MS. T2 sequence is a key sequence for infratentorial lesions. FLAIR is a key sequence for supratentorial lesions. We have the differential diagnosis such as NMO, vasculitis, ADEM, and BML. MRI features useful to discriminate NMO from MS. We have fulfillment of 2, at least of 5, absence of juxtacortical lesions, absence of periventricular lesions, absence of Dawson finger, presence of long transverse myelitis, presence of pre-ependymal lesions along the lateral ventricles. Optic nerve MR imaging patterns, MS, usually unilateral optic nerve is affected. Aquaporine positive, affection of both optic nerves and affection of optic chiasm as well. Anti-MOG positive, affection of both optic nerves, sparing the optic chiasm. Drawbacks: early stages of the disease may show non-specific distribution of white matter lesions. It is a challenge to differentiate MS from other mimickers. Artificial intelligence is an attractive approach to overcome the MRI drawbacks. It refers to the ability of computers to perform tasks that are commonly associated with human intelligence, automate repetitive tasks, analyze more data in less time, achieve higher accuracy and reproducibility. Many of recent publications have been published on the role of AI in detection of MS. We have 2 algorithms in AI, bottom-up approach and top-down approach. Bottom-up approach, which is called the connectionist approach. This approach began with small data and then replicate to larger data. Top-down approach began with large data and then simplify to small data. It's called symbolic approach. Techniques of AI, we have 2 techniques, supervised and machine learning and unsupervised machine learning. Supervised machine learning, the output labels are already defined. Unsupervised machine learning, the output labels are not defined. AI techniques, the deep learning is a subset of machine learning, and machine learning is a subset of AI, artificial intelligence. Convolutional neural network is the most common type of artificial neural network analysis in medical field. We have to know what's meant by data augmentation. We crop the image, then the image is cropped and centralized to resize to uniform size, then data augmentation occurs by the image to be 100 times 100 times 100 pixels. We have 2 steps, step algorithm training and algorithm application. In algorithm training, we supply the images of health control and the disease. We do data augmentation, obtain features, then features applied on the trained convolutional neural network differentiate MS from other mimickers. We have here patient A having hyperintense signal periventricular. This image is diagnosed NMO by algorithm, but diagnosed MS by expert readers. It was NMO. The other patient B, have subcortical hyperintensis, which is diagnosed migraine by the algorithm and diagnosed vasculitis by expert reader and was migraine. We have here manual segmentation. As long as the patch size of the lesion increase, the false positive is decreased. Auto segmentation, patient A is 30-year-old patient having MS. Patient B, 60-year-old patient having NMO. The aims and goals to develop AI-enabled software to assess effectiveness in diagnosis of MS plague, to increase the accuracy and early diagnosis of MS even before the development of typical pattern of plaque distribution, and the ability to differentiate white matter lesions in comparison to the evaluation done by expert neuroradiologists. To sum up, all the workplaces are increasingly relying on computer for rapid and accurate information, and medical field should be of no exception. Not just the neuroradiologists, but also MS clinicians should become familiar with the main applications of AI in the field of MS. Although an expert reader should always be required to review the final output, intermediate steps if needed. Future challenges are better for understanding of the information selected by AI algorithms, appropriate multi-center and longitudinal validation of existing software, and practical aspects regarding hardware and software. We have to shift our thinking. AI will not replace the radiologists, and instead, those who are radiologists who take the advantage of AI may ultimately replace those who refuse it. Thank you.
The next speaker, Dr. Basant Abulhoda, lecturer at Radiology. She will talk about AI for lung